Hello, I'm Dr. Wanye Jonas, and I'm here with Lexi Robinson to do this class on integrative health and primary care using the Hope Note process. Uh, this class is focused on mind-body practices and is part of a series to help clinics uh, implement integrative health care in a routine and regular basis. Mind-body practices are a key part of the underlying determinants of healing, and you can see a number of other classes are also available to help implement this. This class is meant for individuals such as health navigators, health coaches, social workers, medical assistants, and others who are assisting as part of the team in implementing integrative health within clinics. We hope you enjoy it. Let's start. On completion of this session, you should be able to identify conditions for which mind-body practices can help patients, be able to talk to patients about mind-body practices for things like stress, pain, and sleep, identify some resources that will provide to you to address patient needs using integrative and self-care approaches, and then apply some health coaching techniques that Ms. Robinson will show you in applying and using mind-body behavior practices with your patients. So why do we do this? Why are we doing this? Just a brief overview of that. This is part of a larger lecture that you're welcome to see on how healing works. But the basic reason is that we know that medical treatment, things that normally go on in routine medical practice, actually don't produce most of the health within a population or an individual. And this is because health comes from other areas, the two primary ones being behavior and lifestyle, and the social and economic determinants of health. Thus, if we would like our patients to actually improve health, we need to do more than simply do the 15 to 20% in the standard medical visit. We need to get into these other spaces and address the underlying determinants of health. That's the purpose of integrative health, and that's the purpose of the tools that we're going to introduce you to. The tools have to be right. If you're only asked questions about the medical diagnosis, then you'll never get at these underlying determinants. And so we'll introduce several tools to you that allow you to broaden that discussion to 100% of the things that enhance health. In order to make this routine and regular, we recommend some simple tools that we call the Personal Health Inventory, or PHI, and the Hope Note, and some other tools called the Personal Health Planning and the Healing Journey tools. And we'll show you how to do that. The purpose of the PHI and the Hope Note are to engage the patient in a different kind of dialogue, a dialogue around drugless treatments, and around the social and readiness factors they may have. The goal is to move them into self-care behavior and then equip and empower them further so that they can start on their healing journey and tap into those underlying determinants. Your role might be health navigation or health coaching to assist and support them on that healing journey. The first tool is the Personal Health Inventory. This is a simple two-page questionnaire that your patients can take online, and it asks them what matters rather than just what's the matter. It asks them why they want to be healthy. It asks them how their health is in certain areas of determinants and where there's readiness to change. This serves as a baseline area to start the dialogue around the Hope Note. The Hope Note is something that follows what you usually do in healthcare called the SOAP Note. The SOAP Note focuses on what's the matter, making the diagnosis and the treatment, whereas the Hope Note focuses on what matters to the patient and then explores their personal determinants of healing. It has questions in 4 dimensions: the body and the external dimension, behavioral and lifestyle, the social and emotional dimension of the patient, and the spiritual and mental components. In this class, we're going to focus on mind-body practices that have their greatest application in areas of stress, pain, and sleep, although, as I'll show you, there's other areas where they can be useful also. Here's the set of HOPE questions that go into the HOPE note. And I've circled in red there the behavior and lifestyle components that often raise flags as to where mind-body practices may be helpful. Some questions in the social and emotional also may be helpful. Those questions include, how is your sleep? How is your stress? And equally important, how is your stress management, as you'll see, because everybody's got stress. The question is, how do they cope with that? Here's an example of a electronic health record, medical health record, in which these questions have been embedded into it. This is the PHI in a EHR called Health Scout. And it asks the patient, how are they managing into their stress? How are they using their mind to heal? And it gives some examples of techniques such as guided imagery and relaxation. It also asks them how ready they are to make changes in those particular areas. And based on their response in these two areas, you can know whether this is an area that you want to have a specific discussion with your patients about in mind-body areas. Another area to pay attention to is the area of sleep. Although we have a separate class that talks about how to manage sleep and sleep problems, but if they report they're having challenges with sleep and they don't have a medical diagnosis such as obstructive sleep apnea, etc., then these tools can also be useful in those areas. Once you've identified these as an area for further discussion with the patient, then you have to make a decision that I call the two-path decision analysis. Number one, does the patient need referral to more professional help, or can you work with them to embed some skills in stress management into their daily life? If they have mental health issues that are not being treated, they need to be referred to mental health resources, or if they have social issues such as safety and social issues, social work services need to be engaged. However, even if they do have these things, often stress management skills can be useful. And so you can continue to explore the situation and then begin to recommend some integrative health approaches, such as mind-body practices, heart rate biofeedback, mindfulness training, journaling, and others that we'll show you in a minute to help boost their stress management capabilities and resilience building. Health coaching techniques are a specific set of skills that we hope you all can learn, and it is distinct from therapy or counseling. Little red flags that your patients may come up with that require referral for professional counseling are things like major depression or suicidal thinking, eating disorders, substance abuse, untreated anxiety and depression. These require professional help. However, if they're being treated and these things are being addressed, then the health coach can stay in their scope of practice and specifically focus on assisting their patients in engaging in mind-body practices that can build their resilience. If you're trained as a licensed mental health provider, obviously you can then offer mental health counseling. If you're a social worker, you can address the social issues in those areas. But everyone can assist in the health coaching techniques if you learn them properly. So, where does the role of mind-body practices come in healing? Well, the science has been growing, and there's an emerging and robust science on where mind-body practices can help. Many of these practices can induce what's called the relaxation response, and these can directly help overcome things like anxiety, depression, chronic pain, improve sleep and stress. But these practices also have effects on other areas, including strengthening the parasympathetic nervous system. In fact, even growing the brain in those areas, enhancing the reparative processes of the brain and the body, even reversing gene stresses and their expression, and reducing things that we call stress hormones like cortisol and inflammatory markers that we now know, when chronically elevated, contribute to a number of chronic conditions. So your role is to help patients learn about some simple methods to induce relaxation response, such as mindfulness, breathing, biofeedback, and guided imagery, and then support them as they begin to bring those practices into their daily life. Mental resilience and boosting mental resilience is something we all could use, especially in these stressful times. People typically have two options for experiencing these, and depending upon their mindset, they may go down a negative path or they may go down a positive path. If they see stress as something negative that's going to harm them and they're just looking to bounce back, this can have negative effects. However, if they perceive stress as a way to grow, not just to bounce back, but to bounce forward, uh, stress can actually have a positive impact. Those who thrive and have the positive impact also have other things like social relationships, peers, and support. And part of your job is to support them to rechange the mindset and use stress in a positive way. The mind and the body, in fact, are integrally linked. There's no real separation, and the science is clear about that. So another way to reframe how people think about stress and stress management is to show them that there's a comparison between mental fitness and physical fitness. Almost everybody knows that activity and exercise are important to keep your body working and keep healthy, but they may not know that mental exercise is also equally important for keeping both their mind and their body active and healthy. So, reframing this as mental exercise is sometimes a helpful way to help them understand these kinds of behaviors. And also, it gets away from the stigma of mental health. Everybody needs these kinds of mental exercise, regardless of whether they have a mental diagnosis or not. And in fact, in our society, most people are overstimulated because we have a hyper society. Social media, internet, the news cycles all aggravate that. This results in stimulation of the sympathetic nervous system, suppression of the parasympathetic nervous system, where the relaxation response comes from, and the manifestations that then include things like poor sleep, anxiety, digestive problems, inadequate repair, and chronic inflammation. Mind-body practices allow us to more accurately gauge the threat, so we respond to things more appropriately and in a constructive way, and a deep relaxation response. And it's been shown that 20 to 30 minutes per day of mental exercise engaging in deep relaxation can blunt the stress response, grow parts of the brain that make you more resilient, and enhance repair and healing processes, not only in the mind, but also in the body. Here's a partial list of conditions where mind-body practices can help. And as you can see, these are the kinds of conditions that walk into almost every practice's office. Things like chronic pain, fibromyalgia, and headaches. Treatment of things like cancer can be very stressful. Pandemics that we're all living through right now. Other kinds of things like post-traumatic stress and sleep problems can be benefited from these types of practices. Well, let's go on to some of the resources that you can easily use that are free and available that you can bring to your patient's attention and help them engage in their life. Here's a list of things on my website that my team has produced to help understand and begin to implement these mind-body resources. First is an overview of how to deal with mind-body in a crisis like we're in right now. Guided imagery is a very useful approach, and we have a number of pocket guides on how to do that, and free imagery from a psychologist by the name of Belleruth, Naparstek, and I'll show you some of those. Healing tools such as heart rate biofeedback can be implemented by patients, and then various types of guided imagery and meditation, like gratitude meditation, and I'll show you where you can access those free of charge and make them available. Here's some imagery resources that Dr. Naparstek has kindly made available free and can be streamed off of my website. They include things addressing immune support, pain, sleep, stress, a perioperative component, cancer management, post-traumatic stress component, and we have some of these now in Spanish and English. There's the link to go those and to access those, and those are free and available. There's a number of other and a growing world of technologies that are also available, many of them free or at very reduced costs. Here's a list of some of the ones that we use regularly in our practice. to help individuals learn these mind-body techniques. Here's two examples that I would recommend that you try out yourself. By trying them out yourself, you get a better feel for what they're like. And so you can talk to patients more readily about them, but also they can actually help you. One of them is a simple guided meditation, 20 minutes that my team have put together that you can find at this particular link here. A second one is a journaling and a gratitude journal. And at this particular link on this picture here, we show you about journaling and how it's done, and focus on a gratitude journal, which has been shown to reduce burnout and enhance resilience, even doing it a few minutes at the end of the day. I'd like to now turn it over to Lexi Robinson, who works with me as a health coach, and she'll talk to you about how health coaching skills are useful in supporting patients in addressing mind-body techniques. Lexi?
Hi, thank you. I'm Lexi Robinson, and I practice health coaching with Dr. Jonas's patients. After patients have had an integrative health visit with Dr. Jonas, I talk with them about which options they're most interested in, what they would like to try first, what resources or information they need, any obstacles they might face, and how they're going to do this in their everyday life outside of the doctor's office. There are basic health coaching techniques that I keep in mind when I'm talking to patients. These are things like asking questions, listening more than I'm talking, paraphrasing to make sure I understand what the patient is saying, showing empathy, trying to avoid offering advice and instead letting the patient come up with their own solutions. I guide the patient through making SMART goals and repeat those at the end of our call to make sure that there are no disconnects. Ask how confident they are and try to explore ways to instill more confidence and engagement in them. Next slide. Here's an example of a recent patient that I did health coaching with. After Jamie had an integrative health visit, Dr. Jonas sent me a note letting me know that the patient was interested in several different things: mind-body techniques, sleep imagery, improved diet, and yoga. So the first step I took was to email Jamie a number of resources that she could begin looking over and thinking about. So in this slide, I include the actual links that I sent her, so you can see the types of resources that we send our patients. And this is one way to get them started thinking about what they want to do before I get on the phone with them. The next week, we had our health coaching call and we explored what she was most interested in trying first. And this time, sleep imagery was at the top of her list. Jamie hadn't done sleep imagery before, or any kind of imagery. So we talked through the details of exactly how she would do it. In this case, she was planning to use a smartphone. She was going to put it on her speaker while she was falling asleep at night. So I asked which days this coming week that she would do it. And she felt that she could do it on Monday, Wednesday, and Friday to start. She had the link to the sleep imagery in the email I had sent, so she pulled it up during our call to make sure that she could find it and open it up, and it all worked. So she seemed pretty confident that she would be able to do that. So this is one example of a health coaching encounter, but obviously it would be different based on which goal that a patient chose, but the process is similar with different resources. We generally do our follow-ups with patients about 2 weeks out and talk about how things went, what the goal was that they had set, any challenges they faced, what worked, what didn't work. I try to ask a lot of questions and let the patient do most of the talking. Sometimes the goal will remain the same. We might change it a little bit based on challenges or results, and sometimes it'll change completely. but it's a good time during that call to talk about any additional resources that we might need to access to help the patient achieve goals, and to use time during the call to help the patient figure out how they're going to access those if they need that help. Dr. Jonas, I'll hand it back to you now.
Okay. Thank you very much, Lexi. And as you can see, health coaching is a key part, a key set of skills that the team needs in order to support patients to engage in their own healing journey. We've developed, my team and I have developed a number of other tools that specifically for the pandemic that we're in right now. This has led to extensive stress really across the world. And so here's a set of resources that I would refer to you that deal with burnout and how to avoid it, boosting the immune system, which stress and stress management can have a role in, and building resilience in those areas. So feel free to use these. These are all free resources for you and your patients and your staff during this unprecedented time. In addition, we've worked closely with the Tufts Center for Innovation in Family Medicine to bring these same kinds of integrative approaches to the management of chronic pain and opioid misuse. You can earn AMA credits on this. This is a free certification course that you can get at that website, integrativepaincme.com. And I urge you all to check it out. Pain has not gone away. And in fact, unfortunately, the opioid epidemic has gotten worse during the pandemic. So we still need to double down and bring non-drug approaches to pain management and opioids to practice. You can start now. The resources that we've provided you are available. They're all free. They're supported by the Samueli Foundation, for which I work for. If you have any questions, comments, feel free to email me and my team at the email listed here. So we hope you found this class useful in mind-body techniques. If so, then I urge you to go to some of the other areas that we've discussed. Again, we're available for questions and discussions as you begin to implement these kinds of practices into your clinic. Thank you very much, and stay safe and well.